Hello, everyone. Thank you so much for being here today. We are so excited for today's webinar. We're going to be getting started in just a moment. But I do want to just make some housekeeping announcements and also let you know for more information about upcoming webinars, you can visit us online at cuh@berkeley.edu/webinars. And again, thank you for being here today. It's our absolute pleasure to be joined by the Red Hill Registry, facilitated by the University of Hawaii, to discuss jet fuel exposure via drinking water contamination, clinical care lessons from Red Hill. A few housekeeping items before we get started. You are going to be muted during this presentation. If you'd like to ask a question, we welcome you to enter it into the online Q&A box, and we'll save time at the end of the presentation to address as many questions as possible. We're also going to have the chat open, so you're welcome to use the chat to engage in discussion with one another. This presentation is being recorded and will be made available on the COEH website and YouTube page within 5 business days. And all participants who logged in with their registration email for the full live presentation today will receive an email tomorrow with a link to the evaluation form that will qualify you for a certificate of completion with 1 continuing education contact hour. We are offering CME credit for today's presentation, and so our team will be manually creating the certificates of completion rather than our typical automated process. So your certificate of completion will be sent to you via email within 5 business days following the completion of the evaluation and subsequent certificate form. I'm also seeing in the chat that I might be echoing. Is the echoing continuing? Oh, coming in clear. Okay, thank you. All right, without further ado, it is my absolute pleasure to welcome our presenters for today. Rosana Weldon, PhD, MPH. Dr. Weldon is Director of the Red Hill Registry and an environmental health scientist, associate specialist faculty member in the Department of Public Health Sciences at the University of Hawaii at Manoa. Her research interests and expertise are in exposure assessment and environmental epidemiology, with a particular focus on women, children, and reproduction. Dr. Weldon received her bachelor's degree, Master of Public Health, and doctorate from the University of California, Berkeley. We're also joined by Tara Sutton, Director of the Community Engagement at Red Hill Registry. She is a dedicated community advocate and current master's candidate in Geography and Environment at the University of Hawaii at Manoa, or UHM. She holds 3 bachelor degrees in communicology, anthropology, and ethnic studies from UHM. Her research focuses on the social impacts of environmental crises, specifically examining how crisis response tactics affect trust between the Department of Defense and their host communities. A resident of the Navy waterline for 7 years, Tara has been personally impacted by the Red Hill water contamination, deepening her commitment to supporting affected families. As a mother and active community member, she brings a deeply personal and informed perspective to her role in facilitating the Red Hill Registry for those impacted by the water crisis. We're also joined by Dr. Seiji Yamada, MD, MPH, and professor of the UH Department of Family Medicine and Community Health and clinical liaison at the Red Hill Registry. Dr. Yamada is a family physician working and teaching in the area of the 2021 jet fuel spill. And last but not least, we're joined by Dr. Jerris Hedges, MD, MS, MMM, and Dean Emeritus of the University of Hawaii School of Medicine. After serving as dean for 15 years, he now leads an NIH-funded research program to address health disparities that disproportionately affect Hawaii citizens who share less advantaged cultural and ethnic backgrounds, especially those of Native Hawaiian or other Pacific Islander and Filipino ancestry. Dr. Hedges is known internationally as the founding co-editor and one of the leading texts in emergency care, Roberts and Hedges Clinical Procedures in Emergency Medicine, now in its 8th edition. Dr. Hedges also has an eclectic research career addressing myocardial ischemia recognition, trauma system evaluation methodologies, regional EMS research, and other topics. Thank you all so much for joining us today. We're really looking forward to your presentation.
Thank you so much, Michelle. Welcome, and thank you all for joining us today. My name is Rosana Weldon, but most people call me Sanie. I'm the director and principal investigator of the Red Hill Registry. Today, we will be talking about jet fuel exposure via drinking water contamination, clinical lessons from Red Hill. So this event was made possible through the joint providership of the Center for Occupational and Environmental Health, UC Berkeley, and the Red Hill Registry. No individuals involved in the planning or presentation of this activity have any relevant financial relationships with commercial interests to disclose. There were no relevant financial relationships to be mitigated. Next slide. The Red Hill Registry is funded by the Defense Health Agency through the Uniformed Services University of the Health Sciences and the Henry M. Jackson Foundation. The information in the presentation does not necessarily represent the official position of the funders. Additionally, as part of our transparency practices, we want to disclose that 3 presenters today are supported by the Red Hill Registry funding. This includes myself, Tara Sutton, Director of Community Engagement for the Registry, and Dr. Seiji Yamada, the Clinical Liaison for the Red Hill Registry. Our 4th presenter is not compensated by the Red Hill Registry. Dr. Jerris Hedges is a professor and dean emeritus of John A. Burns School of Medicine. He would like to disclose that he was a committee member and author on the clinical follow-up and care for those impacted by the JP5 releases at Red Hill, which will be referenced in this presentation and was published by the National Academies of Sciences, Engineering, and Medicine. Next slide. Okay. After the session, the learner will be able to outline the 2021 jet fuel spill into the Oahu aquifer, identify potential acute and chronic health concerns associated with JP5 and hydrocarbon exposure through contaminated tap water, describe current recommendations for clinical follow-up, symptom evaluation, and supportive care for individuals impacted by the Red Hill water crisis, and discuss the mission of the Red Hill Registry and how clinicians can connect patients with available health resources and monitoring opportunities. As we move through today's session, we will follow a hypothetical female patient who on November 2021 was 47 years old and presented with a rash, headache, dizziness, and nausea. While talking with her primary care provider, she mentions a strong fuel odor in her home while the water is on. To help provide context and background about what this patient was describing in her home, Tara will outline the 2021 jet fuel spill into the Oahu aquifer.
Traditionally known as Kapu Kaki, the area of Oahu that we're going to be looking at today is within the red circle of the map here of Oahu. Today, this place is known as Red Hill and is where the underground fuel storage facility was built in the early 1940s during World War II. On the left, zoomed in here, is the satellite image of the same region, and these red dots represent the placement of 20 tanks lined up in pairs, situated vertically onto the mountainside, merely 100 feet above the Waimalu and Moanalua aquifers, 2 regions of the expansive, interconnected sole source aquifer system. Here you see the Red Hill Registry team inside one of the fuel tanks. We are standing on the platform in the center of the tank near the top where this red star is right here. Each tank is 100 feet wide. And if you remember, the tanks are just 100 feet above the aquifer. So you can see us in the middle of the platform, and the edges of the tank here kind of gives you a good perspective of the dimensions of these tanks and the closeness to the aquifer. Standing at 250 feet tall, the Statue of Liberty could fit inside this tank to the top of her crown. Collectively, the facility is able to hold up to 250 million gallons of fuel and other chemicals. As the largest underground fuel storage facility for the United States military, the Red Hill Bulk Fuel Storage Facility was considered the strategic fuel reserve for the entire Pacific Fleet, which really was incredibly important during World War II. However, according to declassified Navy records, the first spill was documented in October of 1947, and the EPA has since stated that the total amount of toxins released into the environment from this facility is unknown. Vulnerable populations and critical infrastructure surround the facility, including water shafts and wells that are part of the public water distribution system, several elementary schools, a correction facility, and more. In 2014, in January, there was a first major public fuel spill, which alerted the community, state lawmakers, and regulators to the potential hazards posed by this facility. The next 10 years were plagued with more fuel releases and other chemicals like firefighting foam. On May 6, 2021, 19,000 gallons of fuel were released and inadvertently sucked up by a sump pump into an overhead PVC pipe, where it stayed for several months. The pipe began to sag, and eventually, then in November of that year, a cart struck it, releasing the contents, which ultimately found its way into the Red Hill shaft and was distributed through the public water system into homes, offices, schools, daycare centers, places of worship, and public drinking fountains. Notice that this timeline coincides with Thanksgiving, so potentially bringing extra visitors to the island, as well as lining up with the Delta surge of COVID-19. The Navy estimates that roughly 93,000 people were potentially exposed to jet fuel contaminated drinking water from the Navy public water system, marked by the green shaded areas around Pearl Harbor in this map. The Navy water distribution system primarily serves the Joint Base Pearl Harbor-Hickam region, which is home to service members and their families, as well as local residents who work on the base or in federal offices. At the bottom left of the screen, you'll see this area here. This is a neighborhood known as Capilano Beach Homes and used to be military housing, but is now privately owned and used as rentals for civilians. Throughout the shaded areas are schools, restaurants, grocery stores with produce sections that have the automatic misting systems onto the vegetables, parks, major tourist attractions where people visiting the island could have been exposed. As this whole event unfolded, residents received conflicting information from multiple sources. On December 5th, 2021, Navy Captain Eric Spitzer told residents that there were no immediate indication that the water was unsafe and that he and his staff had been drinking it that morning. At the same time, however, videos of oily sheens and reports of fuel orders were spreading through social media and neighborhood group pages. Because contamination varied across the distribution system, some households experienced strong signs of contamination while others did not. These conflicting experiences created confusion about what was happening, who to believe, and whose concerns were being taken seriously. For many military families and others new to the island, this marked the beginning of a breakdown in trust with institutions responsible for protecting them. We will not go through 80 years of potential exposure, but Dr. Yamada will discuss the exposure that occurred during the 2021 release.
You've heard us say fuel repeatedly. JP5 or Jet Propellant 5 is the military jet fuel that contaminated the Red Hill water distribution system in 2021. JP5 is mostly a clear, flammable liquid that largely contains and smells like kerosene. For stability and performance, it contains thousands of hydrocarbon components and some additives such as diethylene glycol monomethyl ether, or diagmi, which is a fuel system icing inhibitor. From animal studies, we know that diagmi causes acute health effects, including headaches, dizziness, fatigue, nausea, vomiting, and eye irritation. While long-term exposure has been associated with health issues of the GI tract, skin, kidneys, and developmental and reproductive systems. About 70% of JP5 is made up of aliphatic hydrocarbons, and around 10 to 15% is made of aromatic compounds like xylenes and naphthalene. These aromatic compounds are the ones more likely to affect human health, even at low concentrations. Fortunately, the water people were exposed to at Red Hill wasn't pure jet fuel. It was heavily diluted with water. Measurement of these volatile compounds in water samples was challenging due to evaporation before or during testing. That said, a broad chemical exposure occurred through ingestion, inhalation, and skin contact. Given the many compounds in JP5, long-term health effects from the mixture as a whole are difficult to predict. As the Navy began testing water samples, they shared results publicly on the Joint Base Pearl Harbor Hickam, or JBHH, drinking water monitoring dashboard on their Safe Waters website. The Navy has tested over 18,500 drinking water samples for a variety of chemicals. Most results have not exceeded screening levels, but concerns have been raised regarding the sampling and laboratory approaches used. Few chemicals that may not be components of the jet fuel have also exceeded screening levels in some samples, including lead, phthalates, total organic carbons, and mercury. Remember, the facility has held a number of chemicals and different types of fuel over its 80-year span. In terms of assessing exposure, there were limited samples taken from the impacted wells or water lines during the same time frame as the acknowledged exposure period. No human biological samples were drawn at the time of exposure, so estimates of individual exposure are not possible. So let's look back at the female patient that we met at the beginning. The provider notes chief complaints of rash, headaches, dizziness, and nausea, and is aware that the patient suffered a toxic exposure to jet fuel contaminated water. The provider takes an exposure history, noting that the patient is concerned about long-term impacts. To try to help the medical practitioners, the Hawaii Department of Health put out a medical advisory in March 2022 with significant details about biomonitoring in this situation and why it was not recommended. The advisory was released over 4 months after the fuel spill, which many viewed as a rather tardy guidance. They explained that blood, urine, or tissues testing would not reliably detect JP5 exposure after the Red Hill spill. See, with our current state of knowledge, samples would have needed to have been taken within 48 hours, and even then, there were not enough established biomarkers to estimate exposure levels, future toxicity, or long-term health risk. The Hawaii Department of Health considered anyone who was in the area and who came in contact with the contaminated water as exposed. This inclusive approach was important given the variability of exposure routes, unknown duration of exposure, and varying pre-existing conditions. The Center for Disease Control and Prevention's Agency for Toxic Substances and Disease Registry, or ATSDR, conducted 3 assessments of chemical exposures, or ACE investigations, to assess the potential health effects of the fuel spill. The Hawaii Department of Health requested the first ACE investigation in January and February of 2022, and this included a self-administered online survey containing questions about potential exposure, symptoms experienced, and whether medical care was sought. The DOH requested a second similarly designed ACE investigation in September of 2022. The Federal Defense Health Agency requested a third ACE investigation to assess the health effects on military personnel in February and March of 2023. This time, the team reviewed electronic military health records, and about a year later, the University of Hawaii Economic Research Organization, or UHERO, conducted a self-administered online survey recruiting participants from the first and second ACE investigations. The Defense Health Agency Epidata Center conducted a study comparing a cohort of Red Hill community members with other military-connected individuals from another part of Oahu. So, with regard to the first ACE investigation, this included 2,289 participants fairly small sample considering the exposed population was roughly 93,000. The most common symptoms were headache, dry and itchy skin, and diarrhea. There was an alarming number of behavioral or mental health symptoms reported, including anxiety, depression, stress, and post-trauma symptoms such as difficulty sleeping and many others. The water crisis and institutional response was traumatic. It is also striking that 75% of participants reported their symptoms lasted 30 days or more. Months after the exposure, people continue to have symptoms, so the state requested a follow-up investigation, which is rare. This time, 986 people who participated in the self-administered online survey and 61% were returning participants from the first ACE survey. 80% of participants reported health symptoms in the previous 30 days, and 65% were highly confident that their symptoms were related to the jet fuel contaminated water. Nearly 10 months had passed since the exposure, and people were still experiencing symptoms at this time. Again, the most commonly reported symptoms were headache, anxiety, dry or itchy skin, fatigue, and difficulty sleeping. 55% reported worse physical health, and 50% reported worse mental health after the incident compared to before. Importantly, participants expressed frustration with communication, transparency, and trust. The ATSDR completed a retrospective longitudinal medical record review. Inclusion criteria was a convenience sample, pulling individuals listed in the Defense Occupational and Environmental Health Readiness System, or DOORS, roster, who sought medical care between November 2021 and February 24, 2023, with overlapping ICD-10 codes of toxic effects and symptoms of interest. All pregnancy-related codes between November 20, 2021 and June 18, 2022, and a 10% random sample of pediatric and adult persons with codes from multiple visits. The most common conditions identified included migraine, chronic pain, depression, eczema, atopic dermatitis, and gastroesophageal reflux. There were some reproductive outcomes reported from the medical record review of ACE3. Of the 653 records reviewed, 45 or 7% of patient records included pregnancies during the exposure window. Of 45 pregnant women, 38% or 17 of the 45 had worsening pre-existing, and 38% or again 17 had persistent new conditions or symptoms. In total, 80% or 36 of the 45 experienced a singleton full-term birth, and 13% or 6 of the 45 experienced a miscarriage. Outcomes for those experiencing a singleton preterm birth and lost to follow-up after 20 weeks gestation had counts less than 5 patients and are shown here. In June 2023, researchers from the University of Hawaii Economic Research Organization followed up with participants from the first 2 ACE investigations with an online survey. Although the sample was small, the results suggested persistent health and household impacts nearly 2 years after the crisis. As shown here, many respondents reported ongoing mental health issues, neurological and gastrointestinal symptoms, along with lasting effects on household well-being, finances, and pet health. Colleagues from the University of Hawaii Thompson School of Social Work and Public Health recently published a systematic review of human studies assessing the health effects of unburned kerosene-based jet fuels. We also abstracted information from other reviews published by various authors, including the ATSDR. Overall, these were mostly occupational studies. Studies of ingestion typically were case studies of accidental ingestion, mostly by children in developing countries. Among the animal studies, many were exposed to high doses. In general, the reports are complex and have major limitations. In the following slides, I will give a very high-level overview of major health effects observed with jet fuel and kerosene exposure. So, with inhalation, under human studies, have been shown increased hospital admissions due to respiratory conditions such as asthma, chronic bronchitis, emphysema, COPD. And these were in a study around 3 U.S. airports where they found this effect when comparing people living within 5 miles of an airport and people living further away. As far as neurologic human effects, ototoxic hearing loss, that is hearing loss caused by damage to the inner ear, has been shown. Incoordination or impairment of eye-hand coordination and memory impairment were shown in a study from Navy aviators who were exposed for less than 1 hour to an unknown high level of jet fuel vapor due to in-flight leakage into the aircraft cabin. And as far as reproductive studies, there has been shown a reverse association between luteinizing hormone, or LH, and breath aliphatic hydrocarbons. In other words, women who had higher levels of fuel-related chemicals in their breath had lower levels of LH, a hormone that plays a key role in ovulation. As far as dermal effects go, this was actually a research study in the 70s where they applied kerosene to the skin for 90 minutes. This was shown to cause hyperemia, or increase in blood flow, and edema, cytolysis, or breakdown of cells, that is damage and disorganization under a microscope. In animals, there were immunological effects showing that the body's immune response is being activated, and cardiovascular effects such as abnormal accumulation of fat cells in the heart muscle and swelling in the heart section. As far as ingestion goes, there have been no reports of death due to ingestion of jet fuels, but numerous studies describe death following accidental ingestion of kerosene, particularly by children in low and middle-income countries. The causes of death were described as gastrointestinal, renal, with albuminuria in the urine, in a few studies of accidental poisoning by kerosene by oral ingestion. In animals exposed orally to jet fuel and kerosene, we see many systems affected. For example, developmental effects where offspring exposed during gestation experienced a decrease in thymic cellularity, meaning there's fewer immune cells in the thymus, an increase in spleen weight, which could be associated with immune activation. And there are potential carcinogenic impacts of ingesting kerosene. So the percentage of females, again, in animal studies, bearing malignant tumors of the uterus and vagina appeared elevated in exposed groups. These were just a few of the health effects seen in the literature. Dean Jerris Hedges will discuss additional details of these studies.
Thank you, Dr. Yamada. I had the honor of serving as a member of the committee that was formed by the National Academies of Sciences, Engineering, and Medicine, or NASEM, as we say, as they developed a consensus report to guide clinical follow-up and care for those impacted by the JP5 releases at Red Hill. That report picture of the cover is shown on this slide, contains information that complements and in many cases extends the information you're receiving today. So I would encourage those with an interest in going a bit deeper to obtain and review that document. As part of the NASEM report, a systematic review of animal and human studies was undertaken, very similar to the report that was just reviewed by Dr. Yamada. Therefore, I want to use my time to focus on some high-level summary remarks from the NASEM report. In particular, significant limitations exist regarding the use of prior studies as a guide for managing those exposed to jet fuel contaminated water as occurred during the Red Hill exposure. For example, animal studies address largely one-time exposures and were limited to a specific route of exposure. Follow-up was done over a relatively brief post-exposure period, sometimes hours to days. Human studies were largely longitudinal follow-up of healthy workers exposed to jet fuel or one-time accidental or intentional hydrocarbon ingestions, often dependent upon self-report of symptoms without consistent laboratory assessments. These studies seldom had control subjects, and those individuals with pre-existing conditions or who were biologically vulnerable were commonly not studied in the occupational reports. I should note that additional information, as reported by Dr. Yamada, was obtained, of course, by surveying those exposed by Red Hill. Unfortunately, we have only a relatively small group of individuals who participated. Extending these summary comments a bit further, there were some relatively unique features associated with the Red Hill jet fuel and water contamination, as this population had a variable duration of exposure. In some, it was days, others weeks, and in a few cases, likely could have been for months. There's also a variable mode of exposure, as you heard, inhalation, dermal, mucous membrane contact, ingestion, all were possible, and often multimodal exposure occurred. There was a strong connection between behavioral symptoms, which were perceived as stress-related, and physiological symptoms. As we noted in the Red Hill community, children were exposed. They're at some greater risk because of their higher metabolic rate, their greater proportional skin surface area, and their thinner skin. Some of these children were immersed for extended periods of times in bathing tubs with water that was contaminated with jet fuel. Some pregnant women were exposed. We don't fully understand the hormonal and metabolic differences that could modify symptoms. And we have limited information, if any, on the stress on the fetus. Elders and chronic illness patients who are exposed at Red Hill. The potential interaction with medicines remains to be delineated, and potential interaction with underlying inflammatory conditions also remains to be determined. So the association of exposure and health effects are really strongest and most consistent with acute exposure, whether we look at the animal studies or at the Red Hill subjects. And that was one of the findings of our literature analysis. And just to summarize those comments made by Dr. Yamada, headaches, including migraine, were common. Skin issues, including rashes and hypersensitivity, and gastrointestinal symptoms, including esophagitis and irritable bowel syndrome, and resultant diarrhea and cramping were common. The NASEM committee concluded that the potential for injury to other organs, especially with an extended exposure, could not be determined from the available literature. Thus, the potential association of exposure and extended symptoms also require further analysis and cannot be determined by the available literature. Extended monitoring, as with the Red Hill Registry, may provide some ability to identify new associations, especially with slowly developing conditions, or may validate chronic conditions that evolve during following exposure. So returning to our case study, a number of exposed individuals have reported persistent symptoms. This is not something we would expect from the short-term studies that were previously in the literature. Our representative case exemplifies this point. So what approach does the NASEM report recommend? Well, there are more details provided in the NASEM consensus report, but a few of the relevant recommendations in the report include for providers to address ongoing symptom-based care with preventive and primary care that is largely symptom-based, to make sure that they've taken a detailed exposure history and put that into the record for subsequent assessments and population analyses, and to use standard diagnostic and billing coding, which may be helpful both for compensation for the visits, but also for linking records in the future, given a very dispersed population, which we'll touch upon a little bit later in this presentation. But in particular, ICD-10 code Z77.111, contact with and suspected exposure to water pollution is a useful diagnostic code. And of course, using a registry which will guide patients to supporting resources, as you'll hear further in the presentations by the Red Hill team, is considered an important part of the next phase of assessment. So going with the next slide, when developing fact sheets, the NASEM committee recommended, again, as I mentioned, general symptomatic clinical care, while recognizing that recommendations will likely evolve over time with additional exposure and health effects information gathered. Supporting patient advocacy when assessing these patients, or in the case of future patient exposure to contaminated drinking water, is important to validate the patient's experiences. Patients may present with a variety of symptoms in various organ systems, or in some cases with limited exposure may present with no health effects at all. But it's important to document their concerns and to ask about possible environmental exposures, not just with the known circumstance that may be on their mind as they present, but also cases where they may have had prior exposure, in particular those in the service with a variety of exposure to chemicals. Also, behavioral and mental health attention is extremely important and may require evidence-based, trauma-informed mental health care or referrals as needed. Now, there's a big component of this that I think is worth pointing out, because we often get stuck in the weeds talking about toxicity of particular chemicals. But when working with a community exposed to a toxin with unknown physiological effects, likely related to multiple modes of exposure and also to the combination of chemical components, it's important that we share the uncertainties that we may have in treating that patient with the community to build trust and not be seen as those who have all the answers when the condition is still under assessment and the event is still evolving. So treatment during the period of uncertainty should be symptomatic, the potential toxin exposed, and longitudinal monitoring encouraged. Such discussions should be done in a culturally sensitive manner such that the community considers its concerns heard and acted upon despite the associated uncertainties. In the Red Hill water contamination scenario, communication followed military protocols with proclamations from commanding officers. This was compounded by sometimes conflicting messaging by the Hawaii Department of Health and ongoing health instructions related to the COVID pandemic. Given that many who were exposed were current or former employees and or dependents of the military, the changing messaging and incongruity between the visible appearance and smell of the water, coupled with new symptoms, despite reassurances from military leadership regarding safety, all created confusion, mistrust, and anger. Those with an island upbringing considered safe drinking water precious and raised concerns regarding the priorities of the military. Unfortunately, early health guidance to the community providers used information extrapolated from past relatively brief exposures of healthy adults or exposed animals, as we have emphasized earlier. Persistent symptoms in the exposed community members were often assumed to be related to anxiety, depression, and psychosomatic responses. Such provider biases further eroded trust in the population. Following health guidance for brief single modal exposure, providers at the time did not recognize the potential for novel presentations. The constellation of new physical complaints which were seen was just not expected by the providers. Factors potentially contributing to provider confusion and knowledge gaps included the unprecedented duration of exposure, the frequent combination of exposure mechanisms, and previously unexposed subject demographics, such as pregnant women, children, and elders. In the course of the representative patient's visit, she asked two important questions. What resources are available to help me now? And what can I expect for my health in the future? This is the perfect opportunity to hand the presentation over to Dr. Weldon, Director of the Red Hill Registry.
Thank you, Dean Hedges. The Red Hill Registry, facilitated by the University of Hawaii system, is the only registry that is collecting data to monitor health outcomes over time of these exposed individuals. Co-designed with the community, the Red Hill Registry aims to track health outcomes to inform future research and clinical guidance on fuel exposure and provide resources for those who experience the fuel spill. There are several collaborators in this effort. The University of Hawaii System Office of Strategic Health Initiatives provides system-level strategy, coordination, and oversight. The Thompson School of Social Work and Public Health, or the Thompson School Registry Hub team, develops tools and protocols and provides scientific guidance to support public health surveillance. The John A. Burns School of Medicine offers clinical expertise and guidance for the registry's referral and education programs. The Hawaii Water Resource Research Center, WRRC, interprets available environmental and water quality data. They also were previously conducting early tap water screening in direct response to community concerns. University Health Partners of Hawaii houses our technology and community engagement team. They support the registry's day-to-day operations and ensure that our data are secure and protected at all times. The registry was funded in June 2024, nearly 3 years after the exposure. So we are working to reach the globally dispersed community now. Specifically, the 3 driving goals of the Red Hill Registry have been clear and community supported. The first goal is to track participants' health status over time so we can better understand the impacts of exposure and support long-term community health. The second aim is to provide community with connections to resources and services. And the third aim is to offer educational programs for both healthcare professionals and community members alike. And this presentation today is part of that third aim. To answer the hypothetical patient's first question, you may direct her to the Red Hill Registry website, which is redhillregistry.org, where we have established a public resource directory powered by Unite Us, a national trusted technology partner for integrating health and community-based care. From the website's landing page, you can navigate to the Resources tab and select Find Services with Unite Us. Then you will find instructions on how to use the platform. Everyone can access the public resource directory to find resources in their area by setting the location to their zip code or city. Then you can select from a variety of topics, including healthcare, social services, housing, childcare, education, and many more topics. In the top right corner of this page, you'll see a globe with the word English. An individual can click on that icon and change the language of the PRD to their preferred language. There are over 28,000 organizations on the PRD, and 86 new organizations have just joined in the last 30 days. An individual can also use our Find a Provider tool that we created at the request of the community by setting the distance to any distance and using the search terms Find a, followed by a particular specialty area. Participants who actually enroll in the registry and complete designated questionnaires can also receive personalized help connecting with the community-based organizations within the Unite Us platform to receive services through our closed-loop assistance request form. The registry's education program, or Goal 2, is multifaceted and consists of both oral and written information. We regularly give presentations to the community, healthcare professionals, at scientific conferences and webinars, and even in high school classrooms. Today's continuing education curriculum is part of our education efforts for healthcare professionals. We also support the University of Hawaii Red Hill Information Hub, which is a website that contains resources and information beyond the scope of the registry's work. We've also published 7 fact sheets on various topics posted on our website listed under the Resources tab, with more coming soon. Particularly relevant to today's discussion are topics such as health advocacy, mental and behavioral health care, and clinical awareness and guidance. At the community's request, we also recently published a healthcare professional letter on our website to help individuals who were exposed discuss the topic with healthcare professionals during their visits and to document their exposure in their medical records. That can be accessed through our website as well. To accomplish the goal of tracking participants' health status over time and gathering information on how fuel exposures may impact health, we need people to join the registry. To honor the community's request to leave no one out and to acknowledge the long history of environmental contamination from the Red Hill facility, the registry developed different questionnaires to capture different exposure scenarios. All individuals must complete a 10-minute pre-enrollment screening questionnaire to join the registry. That basically gives the participant the opportunity to describe how, when, and where they use the water. Depending on these responses, the individual will receive an email either inviting them to complete a baseline or expanded enrollment questionnaire to enroll, or thanking them for their interest if they do not meet criteria to enroll. The baseline questionnaire captures information from those who were exposed in the November 2021 to March 2022 water contamination window. The expanded enrollment questionnaire includes everyone who would use the Navy water at any time before or after this exposure window, as well as those in the immediate area surrounding the green parts of the map that you see. We envision that the expanded enrollment population could be useful for future research that requires a comparison group. Oh, I'm sorry. I also missed that household members who may not have had any exposure, but live with somebody else may also be included in the expanded enrollment group. And we think that they would be useful for a comparison group. Each questionnaire begins with a consent form, and because individuals need to be over the age of 18 to provide consent, we have 3 versions of each. A participant can consent for themselves, a child or minor for which they are legal guardian, or for another adult if they are their legally authorized representative. All consent forms include information about the contents of the questionnaire, risks, benefits, data privacy, and security information, and contact information. This is a quick glance of the questionnaires' content areas and what each questionnaire asks a participant. As you can see, the pre-enrollment questionnaire contains just enough information about the participant and exposure history to screen for eligibility and questionnaire type. The baseline questionnaire is much longer because it contains an extensive list of questions on current and past health conditions and medical care. As we begin to close this presentation, we wanted to discuss the implications of our presentation for you and your practice. As a clinician or health care professional, we ask that you document your patient's symptoms, conditions, and exposure. If you see unusual symptoms that may be related to the fuel releases, NASM recommends contacting the Defense Health Agency at dha.redhill@health.mil or your ATSDR regional office about your observations without including any private health information in your email. We also encourage you to refer patients to enroll in the Red Hill Registry and become familiar with the resources that are available on the registry's website. Some of you may also be interested in conducting research to close the knowledge gaps surrounding jet fuel exposure and long-term health effects. The registry serves as a data repository for researchers to request de-identified data, and researchers can also augment the registry's data by recruiting from a pool of participants who have agreed to participate in future research studies. Future efforts might focus on effects of exposure among sensitive populations, particularly children and pregnant patients. As I mentioned previously, the registry also has contact information for potential control populations, which are necessary to better understand the nature of any increased risk among exposed persons and to assess the impact on the overall population. This concludes our presentation. Thank you all for attending today. I would like to take a minute to acknowledge the Red Hill community and the people of Hawaii who recognized a problem and fought for answers. We encourage you to follow the registry's social media channels, and you can contact us at info@redhillregistry.org or by phone. I would also like to thank the Center for Occupational and Environmental Health for facilitating this webinar. We're happy to take any questions or comments. Thank you.
Excellent. Well, thank you all so much for an amazing presentation and just this wealth of information for all of us. At this time, to our attendees, we do have time for questions. So if you have any questions, please go ahead and enter them into the Q&A. I'm going to go ahead and read them out loud for our panelists here to answer. The first question that we have in our Q&A, I may have missed it, but were the pregnancy outcome frequencies comparable to the general population or similar populations?
Yeah, this is Jerris. Hedges. I will go ahead and just say a little bit. Our biggest problem with some of the conditions is just we didn't have a large enough sample size. Although we didn't really want the sample size to be larger. We didn't want more women who were pregnant exposed. There is some suggestion that the frequency is a bit high, but it's not large enough to make a statistical statement. And so we really want to follow some of the women subsequently to see if they've had further problems related to subsequent pregnancies or attempts to become pregnant.
Thank you so much. Yeah, absolutely. And I also want to share, in the preparation for this webinar, we appreciate having attendees from all around the country because the folks who have been exposed are not necessarily still in Hawaii. And so I'm wondering if maybe this group can speak a little bit to some of the distribution and where providers all around the country, if not the world, should really be paying attention to some of these issues and potentially needing to refer their patients.
Maybe does Tara want to speak to that?
Well, excuse me, right now what we can say is that there are people accessing our public resource directory from all 50 states. And as far as our enrollment data is showing, we have people in, gosh, Sanie, you could probably confirm how many countries, but
we have people. So we do ask as part of our questionnaire where people are today. And we have, in terms of international contacts, we have participants in Japan, I want to say Italy, Germany, well, Guam, but that's a U.S. territory. But basically, we have a pretty good spread. You can imagine that there are a higher concentration of participants who are on military bases internationally, and also we have concentrations of people within the United States in Texas, Virginia, California, Washington, largely places where there are military bases. Hawaii, obviously.
Thank you so much.
Yeah,
I also have Oh, go ahead.
Also, just to throw in there, many of the people who were exposed were either active duty or dependents, and hence many of them have either been deployed, have been reassigned elsewhere around the globe, or may have left the service. So this is a challenge. The registry is working very hard to make contact, and any assistance from those on the call or on this webinar would be greatly appreciated.
Excellent, thank you. And how many people are currently enrolled in the registry?
So because of our two-tier system, it's usually easier for us to summarize that there are about very close to 2,700 people who have begun the questionnaire process. Some of them are in various parts of continuing to finish their questionnaires.
Thank you. Another question, how do the exposures or doses used in the animal studies or the occupational studies compare to the estimated exposures amongst the Red Hill residents?
Well, this is Jerris Hedges again, and maybe Dr. Yamada would also like to comment on this, but my understanding from the literature we were reviewing is that we have some clear cases where toxicity was reached in some of the exposed patients that we can be very confident about. Others we have less certainty about. But elsewhere, you don't see this multimodality where people bathe or shower in the water and are exposed to the fumes, where people cook their food in it, where people have drunk the water or mixed with their food, or it's on their clothing and they've worn that. Children bathed in tubs full of it. So the type of exposure is it's much different. But for a few of the chemicals, we were able to ascertain that something that was advised early on, which is you're not having a significant exposure if you don't smell the hydrocarbons. That just isn't a reliable marker. Some of these were in sufficient concentrations below the ability of your senses to detect. And secondly, not everybody has the same ability to smell hydrocarbons. Plus, if you add chlorine, when you chlorinate the water prior to its use, as was done in this case, that may mask some of the hydrocarbon odor. So we have pretty good, evidence that toxic levels, as were demonstrated in animal studies, were reached in a number of the individuals exposed. But we just don't have biological markers to validate that on an individual level and individual organ system level.
Just to add and complicate the exposure scenario, that the chlorine can also contribute to the exposures of byproducts that are formed when you mix chlorine with hydrocarbons. So we're also unsure about some of the toxicity of these decontamination, these chlorinated byproducts.
As far as the animal studies, obviously, because they are experimental animal studies, rather than human studies, they were able to administer much higher doses to determine things such as the LD50 or the lethal dose that would actually kill 50% of an animal population.
Thank you so much. Another question, and we are coming close to time, but I want to make sure we get to this one as well. First, with the comment, thank you for this excellent presentation. They were wondering, how does this or doesn't this relate to the various registries that are maintained with the VA?
So this, as I mentioned, this is the only registry that is tracking long-term health of participants. The VA, from what I understand, takes a somewhat different approach, is that they consider anybody who was in an area who had an exposure exposed. It was part of the CARES Act, right, Tara?
Yes, they take an exposure informed approach to the care that they provide. The registries that the Defense Health Agency oversees, like the Jerris Registry, those are not necessarily tracking the health long term. They are more of like a roster of people who were in the area that were potentially exposed, and therefore the VA is able to see that annotation when the service member goes from active duty to veteran status, and then the VA is able to take that exposure informed approach when treating this patient when they come in to seek care. The Red Hill Registry, sorry, go ahead.
No, I was just going to say, but in terms of actually having a mechanism to collect the data in one place to look at a broad picture of exposure and potential health effects, that is where the registry comes in. The VA has access to individual level records and can see that an individual was exposed, but the registry is definitely the best way to perform epidemiological studies and answer some of these questions about long-term or delayed health effects in relation to exposure.
Well, again, thank you all so much for your essential work at putting this presentation together and sharing it with this audience today. We really appreciate you all being here and being there every day for the residents who are impacted by this exposure. We do have a couple of questions about continuing medical education, so I want to make sure to make another announcement about that before we close. Once you close today's session, you're going to get a pop-up with a post-course evaluation. Once you complete that evaluation, you'll be redirected to provide a certificate of completion request form. Our team is making the CME continuing medical education certificates. So within 5 business days, you'll get an email after submitting that form with your certificate of completion. And then also tomorrow, you'll get a reminder email with the evaluation form directly from Zoom as well. If you'd like a copy of today's slides, you can email us at coeh@berkeley.edu, and I will put that email in the chat as well. And again, thank you all so much for being here today. Thank you for your work. Thank you for joining us online, and I hope you all have a wonderful and restful weekend.
Thank you, Michelle.
Thank
So
you,
much.
everybody. Mahalo.